Pediatric pulmonology is a relatively early discipline. There's only 4 pulmonologists in the state sector in Johannesburg. So it's certainly a need. Your respiratory infections is one of the commonest infections that children have. The joy that you see as you have a sick child and the child that recovers from that illness is something that's really satisfying. Also the parents, they're vulnerable when they come to you, they're looking for help, and the joy that you see in the parents' face as they leave the hospital is also something that's really satisfying.
He's a hard worker, very conscientious, very responsible, and being able to work as part of the team when he serves the children and also when he's teaching and supervising the juniors. He's got that love and attitude that shows that he cares for others.
He's committed, he strives for service excellence in everything that he does. Most importantly, he collaborates. He truly listens to his patients and his fellow colleagues and goes out of his way to ensure the best service delivery for them. He's also involved in lots of academic research, and the work that he's done there has been recognized internationally.
To be a public servant, it's not a job. Being in the public sector requires some sort of passion towards your work, and you need to realize that the greater good is what you're serving. I think if people see it as a job, then it will only be a job. Then you never grow into this platform where you feel that you're making a meaningful difference.
I'm a rheumatologist and more importantly leading the COVID team here at Baragwanath Hospital. This COVID pandemic is unprecedented. It's not something you expect to experience any time in your career. Having to put on PPE for the first time was extremely daunting. Walking in to the house after my first shift in COVID, meticulously removing all the traces of work, and only then coming in and giving my son a hug. Yeah, that was a difficult time.
Dr. Makan came at the time when all of us were under significant stress. Our choice was actually confirmed by her leadership within the team. Not only did she work with people within Chris Hani Baragwanath, she managed to work with people outside Chris Hani Baragwanath and actually put together with her fellow consultants protocols to ensure that COVID patients are treated appropriately.
Coming to a place where you know that any little bit that you do is going to make a difference. Seeing the sickest of the sick walk through the doors or actually being pushed through the doors, and knowing that behind that patient was a family, somebody that depended on you to bring their family member back to them. I think that was our major driving force.
So when most people were feeling quite paralyzed by what was happening within our country, she was able to take on a completely new position within this hospital and develop a seamless system of care for patients where protocols at that stage were not developed. She went out and did the research and ensured that patients within the public sector here at Bara got the best possible treatment available.
As a doctor, your purpose, your primary duty is to serve your community and offer service to your community, whether this is in the private sector or public sector. It doesn't matter, your ultimate goals are the same. For me, it's about putting the needs of your patient ahead of your own, no matter what sacrifices you have to make in order to achieve that.